Good morning, everyone. My name is Peter Gudaitis. I'm the Executive Director of New York Disaster Interfaith Services, and we're happy to be co-hosting this webinar this morning with the Interfaith Center of New York, represented by the Reverend Dr. Chloe Breyer, who's with us, as well as the Mayor's Office of Thrive NYC, which is the city's mental health education and support services program. I'm also joined by Father Stephen Harding, who is going to be our trainer this morning on the toolkit, which was co-written by Father Harding and the Reverend Dr. Storm Swain, who is not with us. And then we will have a panel discussion moderated by Rabbi Simcha Weintraub and his co-panelist, Rabbi Nancy Weiner. So unfortunately, our third panelist was not able to join us this morning. He had a medical emergency in his family. So Simcha, Nancy, and Stephen will be having our panel conversation with us this morning. So I do want to draw your attention to this cover slide, which does have the link to where you can download the toolkit for free. The toolkit includes both a evergreen component, which is the city's standard Thrive NYC toolkit, and then a pandemic module that was added to that resource. And there's a good bit of information also about mental health assessment and referral, which Father Harding will take us through. Slide. Next slide. I just want to remind everybody this is being recorded and it will be archived on YouTube for future use. We've done a series of webinars now, both around the topic of grief and trauma, as well as mental health during the pandemic. This particular webinar is with and for Jewish leaders. We've had a previous iteration for Christian leaders and one for Buddhist and Hindu, which will also be followed by African diaspora and Muslim leaders as well. If any of you are interested in the second webinar on grief and trauma, that will be offered next week, and you can find that link on our Eventbrite page. So Father Harding is going to take us through the next 20 minutes, and the first thing he's going to do is show us a video from Thrive NYC. Thank you.
My name is Susan Herman, and I'm the director of the Mayor's Office of Thrive NYC. Thank you for joining this webinar on faith and mental health. Thrive promotes mental health for all New Yorkers, and we do this by closing gaps in care so that people and neighborhoods who have gone underserved for too long can access support where, when, and how they need it. But we know that when you talk about promoting mental health in our city, you need to talk about faith communities. We know that faith leaders listen, counsel, and help heal psychic wounds. And we know that your congregations turn to you for guidance and support. For the last few months, when so much uncertainty, sadness, and grief have been layered onto New Yorkers, your leadership has sustained so many. And we thank you for being there for your congregations. We're also grateful to our partners at the Interfaith Center of New York and New York Disaster Interfaith Services. Together, we offer you a toolkit with suggestions and resources to use now during the pandemic and for years to come. We hope that today's conversation will be lively and informative. Thank you for all you do to promote mental health and spiritual well-being in our city. And thank you for taking the time to be with us today. My name is...
So, good morning. My name is Stephen Harding. For the next 19 minutes, I will walk you through the toolkit and then we'll have discussion from our panelists, and then a question and answer time. So I am the minister at Grace Church in Vineyard Haven on Martha's Vineyard. Before I got here, I was actively involved in the faith community in New York City. So the objectives of this webinar is to look at the context that we're in, to tell you what this toolkit does, to show you how it can work for you. I want to tell you the four most important things in it, and then provide referral resources for you, and to answer your questions as time permits. And you can always ask a question by using the chat feature, and just type it in, and we'll address it. So thank you again for being with us this morning. And I want to tell you a little story. This Pier 94 is where one of the family assistance centers after September 11th was. I was one of the volunteer chaplains through the American Red Cross, and I was standing by the door of one of the family assistance centers, and this woman came in. She looked a little disheveled, a little disorganized, and I went over and I said, "Hi, I'm Stephen Harding. I'm one of the chaplains. How can I help you?" And she said, "Well, my son made me come here." And I said, "Okay." She said, "I've been lying in bed with the covers over my head since the attacks happened, and my 8-year-old son came into my bedroom and told me that I had to get up. He told me that I had to come here and that I had to get help. So here I am," she said. I said, "Okay, thank you. May I introduce you to a colleague of mine?" And she said, "Sure." And then I walked her over to one of the mental health people, and I introduced them, and I stayed with them until they'd done the introductions, and this woman went off with the person from mental health. So I tell you that story because every disaster has a life cycle, right? So you start with the event, then you have the response, the aftermath, short-term recovery, long-term recovery, and the learning that you get from everything that you've gone through, and then you prepare for the next one, is how this model works. And I would put that woman somewhere right in the aftermath. This emotional trajectory of a disaster, I would put her, you go along, the disaster happens, and there's a dip, and I would put her in that dip. The heroic phase rises, and then there's a long period, a steep period of disillusionment. You know, nothing's working. I've done all the right things. It hasn't stopped. My condition has or has not improved, but it's still here. So then you work through with whatever it is, and you come to a new beginning, right? So that works really well for single event disasters like September 11th, Hurricane Sandy, floods, things like that. But the thing about disasters is that all the mental health challenges that were in place before the disaster are still in place. And all of the pre-existing realities get magnified, the stress gets increased, the access to care decreases, and there are multiple losses, not just of people dying, but in our case with COVID, all the routines that we used to do, the morning coffee from the coffee cart, that's gone. Spaces, jobs, physical closeness, touch, just going out for dinner. It's a loss. And over time, this gets, the disillusionment gets even more. So it's hard enough when there's just a single event pandemic, but the COVID isn't a single one-time event. It's ongoing, and we're also facing the anti-racist movement across our country with George Floyd's death. So now we have two events going on at the same time, and one might be here in the middle of the COVID, but you might just be here starting with George Floyd and the anti-racism movement. And the two of them can combine, especially if you're a person of color, to put you way down here, but you can be way down here for George Floyd and somewhere else for COVID at the same time. So spiritual well-being and mental health well-being is really tricky when you have more than one pandemic that don't start at the same time. So that's why this toolkit is really helpful. So the first most important thing about it is that as faith leaders, to look for length of time and acuity of symptoms. So my woman at the Trade Center Family Assistance Center came in 2.5, 3 weeks after the event. So that was one piece. She had acute symptoms. She wasn't getting out of bed, covers over her head, and her 8-year-old had to come in and say, you got to get up, you got to get help. So that the acuity of her symptoms and the length of time since the originating event made me realize that she needed to go immediately to a mental health person. So what we're going to do is just look a little at the signs and symptoms of stress, normal, acute, traumatic, risk factors for traumatization, secondary trauma, and then a little bit about suicide. So stress, right? Feeling anxious, lonely, or sad is normal to the conditions of physical distancing, isolation, and quarantine. That is a normal reaction. That's a normal stress response. And the toolkit on page 30 gives you a whole table of symptoms of stress for cognitive, emotional, physical, spiritual, and mental. So it's helpful to see what's there. So acute stress, the next step down this is the second most important thing in this toolkit for me, is to know what the symptoms of acute stress are. They go on for a significant length of time, not paralleled by any external stressor. The symptoms are magnified or experienced most of the day, like for this woman, she was in bed all day. And the symptoms of stress begin to affect a person's ability to care for themselves or be in relationship with others. She fits this. And so acute stress is where we begin to pay attention, where I think we should begin to pay attention. And it's important to know when you're in over your head, when you've reached the limits of your training, of your knowledge, of your ability to help. This woman at the Family Assistance Center was beyond what I knew how to do. So I referred her to someone who knew more than I did, who could help her. But you have to know where your limit is. Because now we start getting into signs of traumatic stress, right? And trauma. And this it's out of what I know how to deal with long term. So traumatic stress starts to be considered if these symptoms continue 3 to 6 months after the event. And remember, we have multiple events with multiple timelines going on. And Also, in the Mental Health Toolkit, rather than read through all the slides about traumatic stress symptoms, are terms and definitions, mental health, mental illness. It has a section on moral injury, on grief, on complicated grief, on funerals, on self-care, how to support mental health all year round. And it's got a mental health action calendar in it. So there's that. And while we've had this little excursion into everything else in the toolkit, I also want to really emphasize that in addition to normal stress, acute stress, and traumatic stress leading to trauma, that we as faith leaders are exposed to multiple deaths, multiple injuries, multiple losses, multiple grief, and sometimes not being able to do what we think we should be able to do because these COVID-19 circumstances don't allow us to be present at the time of death, be present with the families. Funerals are a huge issue. So we as faith leaders are at huge risk for secondary or vicarious trauma. And we have to really pay attention to what's going on around us and how we're doing. And the self-care section usually gets short shrift, but it shouldn't. Because if you start feeling any of those symptoms of acute, or you feel like you are at risk for traumatic stress, I want you to stop and just do an assessment as to where you are and what you need. And that's what the toolkit really is there for. Because Dr. Lorna Breen, an emergency room physician in New York City, and EMT John Mandello of the New York City Fire Department were both caregivers, and both of them took their own lives. The reason we think is because they were overwhelmed by trying to care for so many people when the peak of the COVID-19 illness was at its height. And we included them here to honor their lives and their service, but also to make it real as to what the actual risks of secondary and vicarious trauma are. There's more information about suicidality on page 43 of the toolkit. And you doing what you and I do over time in these situations can have an effect on you. So please take care of yourselves as well. The fourth most important thing in this toolkit is to know when to refer. One should refer, and this slide should look familiar to you because it's the acute stress slide. And when to refer is when the symptoms of stress continue on for a significant length of time and are not paralleled by external stressors. Symptoms of stress are magnified and or are experienced most of the day. And the symptoms of stress begin to affect a person's ability to care for themselves or to be in a relationship with others. So that's when to refer. How to refer is you talk with the person. You don't just say, oh, you need to see somebody else. Here's their number. I want to tell you another story. When I was working at one of the hospitals in Manhattan, I got a phone call from one of our interns who was on call on a Saturday afternoon. And she said, I've had this woman call because she wanted to say goodbye to the rabbi. And I said, oh, and? Well, she said, this woman on the phone, she sounded a little, not quite right. And when she said she wanted to say goodbye to the rabbi, I got concerned and started thinking maybe she's suicidal because of the other things that she said. I said, well, I think you're probably right. You have good instincts. Can you call her back? Sorry. And just remind her that it's Shabbat and that the rabbi is not available on the phone until after Shabbat is over. And could she wait until then? And my intern said, sure, called her back, relayed all this. And after sundown on Shabbat, the rabbi called this woman and said, I understand you wanted to say goodbye. And he had a conversation, which ended up with him going to where this woman was, met her, and then brought her to the emergency room and sat with her until she was admitted. And then is when he said, I'll see you again, and left her. But that level of concern, of care, of being with, of guiding her, of walking with her to get her the help she needed is a huge part of how to make a referral, because the person, I think, does not want to feel abandoned by their spiritual caregiver. And the concern that you have for the members of your community of faith will come through if you do things like this. If you have the option, present different possibilities of care. Talk about matters such as fees, location, accessibility, and all that. But never let the person feel like you are going to abandon them, but that you are there as their rabbi, as their spiritual care provider, until you are there with them for as long as you need them. You never abandon somebody. A resource for you to refer to if you don't already have a list of therapists or psychiatrists that you know and have worked with and that you can recommend with confidence, which is always the best way to go. NYC Well provides free and confidential mental health support. Multiple languages, you can call them, you can text them, you can go on their website, you can chat with them. And this is part of the filters that they have when you go to the NYC Well website. You can see, I think, that they have a category for dual diagnosis, co-occurring disorders, first responders, HIV, AIDS, homebound, homeless, all the different things. Payment information, your age, what borough you're in, it's really comprehensive. And the crisis support team was pointed out yesterday is made up of not of police officers, but of mental health professionals who will come to the location where the individual is and help get them the support they need. We included in the toolkit the national helplines for suicide prevention, the domestic violence hotline, the National Alliance on Mental Illness, the substance abuse and mental health services, and the disaster distress helpline. And all of those are resources for you, and they're in the Mental Health Toolkit. So just to end with this, it takes a while to internalize this toolkit, but I find it really helpful to open the door to getting people who need mental health professionals to them. It's a vehicle for them to go through. So with that, I am going to close and turn it over to Rabbi Simcha Weintraub.
Thank you very much, Stephen. That was just an incredible use of a short amount of time. Really, really brought us a lot, so thank you. So I do want to turn to the panel now, my panelists. And I'd like to ask Nancy, if you don't mind, Rabbi Wiener, I'd like to ask you one question to start things off. I wondered if there were any particular messages in the toolkit that had particular resonance for you as someone who's been helping people through this and other disasters. Oh, are you muted, Nancy?
Sorry. So the thing that spoke most loudly to me was the section on self-care. And the ways in which we have to be aware of the impact and on the fact that all of these stressors that we are attending to in other people are stressors that we ourselves are feeling. And that the disorientation that other people are feeling is shared by us. And therefore we have to pay attention. If we're going to be present for other people, we really need to be present to ourselves and be, as was mentioned in the presentation, monitoring ourselves and recognizing the ways that the structures that help us know who we are and how we fuss as we've been homebound. So that the distinctions between work and home, the distinctions between, in that category, the distinctions of I'm at work, but I'm also sitting in my living room. So what does that mean in terms of somebody else coming through that space? And the fact that as my workday is interrupted by the daily patterns in the space that I'm inhabiting with others, so too the time that I would normally designate as time off or downtime at home may not be able to function in that way normally because other of the break-in rhythm for other people in the times when issues arise. There are also other issues that have to do with the ways in which we are hardwired to respond to certain situations, and that hardwiring has been short-circuited. The ways that we have been socialized and the deep beliefs that we hold that give us a sense of belonging and knowledge of why we do what we do. The things that are first nature, not even second nature to us, have been interrupted. Someone's sick, we go visit. Someone's dying, we go and accompany them and offer a means to engage in a life review and hopefully find some peace. Someone's died, and we have shared with others the ways that our rituals help us mourn and help us grieve and go through a process over a period of days and weeks and months, with time spent sharing stories and being present for people, all being part of the balm that we offer for healing. All of that's been interrupted. And as clergy, we're feeling frustrated and helpless and angry and lost. And we are trying to care for people who are feeling the same. For those of us who are clergy, who are hardwired to be at the forefront of human rights related protests, who are of a certain age where there's now risk in doing that, are feeling a sense of loss, a sense of failing, a sense of there's an urgency and I can't be the one who's responding. For us in self-care, I think of the message on a plane where we're told, put the face mask on yourself before you try to put a face mask on anybody else, even someone for whom it seems desperately needed. And the call to us right now to take care of ourselves, to have our own spiritual practices that we're keeping up and our own relaxation practices. That people are go-to people when we need support and when we need care. And to recognize that we have models to look to in Vayikra in particular, where the priest needs to go outside and get rid of the ashes and take time to clean clothes and to cleanse themselves, and then just to wait before going back in and re-engaging. And that the need to not do everything, for me, found in the message of the Chatat offering. We can partake of others' Chatat offerings, but we can't eat our own. We have to have others do that for us, and allowing ourselves to utilize the resources that are available for us. And to remember that in Hebrew, it's a false cognate, but it works for me. Mikvah and tikva have kuf, vav, and hey in them. And we can find hope when we believe that there are resources. And when we feel despair and overwhelmed and exhausted, we can also bring all of those and feeling that they just can't continue with the realities that are COVID, from the families that are dealing with mental health in their four walls, and individuals who would normally have some more structure in their lives, who have lost it and need it, to the people who have people who they cannot visit, who may not be capable of understanding why there's now an absence of contact when there's been regular contact before. So those are the areas that I'm thinking of that really spoke to me from the guidelines.
Thank you so much. Time for another question? I know you have to get off.
A quick one, sure.
Okay, sure. So just wonder whether in the area of either successes or challenges, whether you could name maybe one of each that you faced in trying to be there for people who are struggling emotionally during the pandemic, just to highlight one or both if you can.
So I'll start with the challenge. The challenge has been with families where there's been a death and where the family members themselves can't normally come together, and they not only can't be with each other to support each other, but they also can't be all present at the funeral. And the tremendous pain and guilt and sense of loss and unsatisfied emotional and spiritual needs are a tremendous challenge, and one that I think as a community we really need to be thinking long term about how to go back and work with the families who didn't have the normal grieving process, and to recognize that their grieving is going to follow a pattern that we have never seen before in the numbers that we're going to be seeing it. And what will happen when certain areas open up and people can go to cemeteries and people can gather to figure out how best to support and help them move forward is going to be an ongoing challenge. And in terms of a success, the synagogue that I belong to has created a network of tens of congregants who weekly reach out to 5 or 10 other people who they now speak to every week and find out how they're doing and check in. And they've created new networks of relationship within the community, but also now have a way so that the clergy in the congregation can be alerted if there's something that's changed or needs attention for an individual in the community that they might not have otherwise known. So,
Thank you so much. Thank you, Nancy.
thank you.
Okay. And I know we have just a couple minutes. I'd like to ask if, Stephen, if you had any response to anything that's come up, or you could answer the same questions, or either anything that you want to focus on. I think it's stunning that self-care is what Nancy first highlighted, because very often in workshops we used to leave that for the end, and now it's really important to put it up front. So I'm glad that was named.
Yeah, I mean, usually self-care is an afterthought, and it's like, well, you should eat good food, you should exercise, you should sleep, you should make time for yourself, you should whatever. And if you're like me, you say, oh yes, I know, and ignore it and just charge on, because there's so many things to do. Over time, when I was working at Jacob Perlow Hospice, this is well before any, the pandemic. I had a day where 3 patients that I was following died within hours. And I just remember going home. It was in the spring, how spring can be when it's really nice in Manhattan. And the light is kind of spring-like and summery, and it's warm for the first time. And everyone's just relaxed because now it's warm and sunny. And I remember just walking down 2nd Avenue, I think, looking at the light on the trees and thinking, these 3 patients are seeing this light from a different perspective. But I'm seeing it from my perspective. And I just slowed down and looked at the light on leaves, which sounds really trite. But at the time, given what had happened, taking that 4 minutes just to be and breathe and look at sunlight and remember that the whole world wasn't dying, and that I was dealing with a very skewed population at the time. Now it's not so skewed. But then just taking that time, taking a breath is so important. When I was working with the fire department, we had Black Sunday on January 23rd, 2005, when 6 firefighters jumped out a window in the Bronx. And they got brought to an emergency room in the Bronx. And there were 5 people. One of them was dead. So there were 4 people being worked on in the ER. And there were teams of 8 people working on each of the 4 firefighters. And it was so easy to get swept up into the drama, right? Of what's going to happen, what are they going to do? And I realized that I just had to walk away and get out of being caught up in what was happening. And as I went to my car to get rid of my bunker gear, it's like, just breathe. And I took off my gear and put it in the car, and I walked back. And as I walked back, it's like, what do these people need from me right now as their priest? But having that moment of reflection, self-awareness, time, just to breathe and recenter was so important. And that's why self-care is so important, to have a little distance to relocate oneself, recenter oneself. Because this pandemic and the anti-racism movement, they are just relentless. And if I, even in remote Martha's Vineyard, can be affected by it, I have no idea what it's like in New York City. Just how ongoing everything that you're having to deal with. In addition to working from home and family and sharing screen time, I have no idea. But it is so important for you to take the time you need to breathe, exhale, and regroup. And that's all part of self-care.
So much, Stephen. And so we have time now for questions from the group, if I'm not mistaken. Would anyone like to start with a question about the toolkit or the points that have been so far raised, or something you'd like to ask in general?
I have a question that maybe, Simka, I could ask you. It's like, what's the biggest challenge for you about the COVID-19 pandemic? Because you mentioned that you're now in a smaller living situation than you were.
Yes, yes, and I think when Nancy was talking about space and setting aside a space, and you were talking about self-care, I was thinking so much about how folks out there who might have gone to a sanctuary, meaning a religious sanctuary, a chapel, now often don't have the access to that, and they certainly don't have the same access to, the supportive community in the same way. And so people are reaching out via not just prayer by Zoom, but study and social activities, social action activities, and it's really so important because it gives extension to your space, and it gives there's you can go to the Joyce Theater online, you can go to Yellowstone National, you can, and it's really important to vary that and to take some risks also. So for me, it's been finding ways to renew connections. And I will tell you one amazing thing that happened to me. That Saturday night, many weeks ago, where they had the Global Citizen, I think it was called, concert in 2 hours on a Saturday night with everyone from a doctor in South Africa to Gutierrez from the UN to Paul McCartney. It was just this incredible experience. I was very, very, very moved by it. And right afterwards, I thought, oh, I've got to call cousin so-and-so. I've got to call, and then suddenly I thought, I've got to call Chaim. And Chaim was my best friend from ages 3 to 12, who I hadn't seen in 45 years. It means I saw him when I was about 20-something. And I said, I'm going to do that tomorrow morning. It was late Saturday night. Well, the phone rang, and it was Chaim. He had the same, for different reasons, he had the same thought or feeling and calling, literally. So, and I realized that what I was feeling in the concert was this network around the world, and that we each have like these, I have to call them spiritual networks of people that we love and people who give to us and get from us, and so I've been kind of reaching to escape from the confinement. As the Talmud says, the prisoner cannot free himself from jail. We really need other folks to unlock the key. And it does feel kind of like jail. It even feels kind of like punishment. So that's my response. Thank you.
I remember, sorry, I remember I discovered that the world's major museums were available online. And it wasn't so much where I ended up. I went to the Hermitage in Russia. I've never been there. But just sitting in my kitchen thinking, I have a choice. I can choose London or Russia or Vienna or Egypt, anywhere. And just to have that sense that I had choice again was extraordinarily disproportionately reassuring.
Yeah, yeah, yeah. Thank you. Thank you. Chloe, Reverend Brian.
Thank you so much. I'm just wondering, like, to hear from anyone who has knowledge of that, how are, I feel like the healthcare workers, you know, nurses and chaplains also, who are still really hard at work in a lot of our hospitals. Now, sort of, it feels like in some ways, even being in New York, the rest of the world has kind of moved on, in the sense of, you know, all the attention that's been on the protest, all the attention, you know, the weather makes a difference. People are outside. We're in phase 2. Like, does anyone know? I mean, how is it going for so many people who are still doing this work but don't have the public attention in the same way that they did? It must have been quite sustaining. I guess that goes for family members too, who lost loved ones.
Yes, yes, yes. And during the beginning weeks and months, I do know that people who had normal losses, in quotes, not to COVID-19, but to heart attacks or cancer, felt disenfranchised, and now as the media, like you said, as the media shifts, people can feel really unsupported, and yet I do know that things peer-to-peer support is thriving now, and that there's an understanding among healthcare professionals that they need us. I'm sorry, there's noise outside here. They need particular time and space and spiritual care that before they were either ambivalent about or not accepting or exploring. And I think, and so in other words, I think that things are happening. I heard about a Nigun circle, a chanting of wordless melodies that people do for a few minutes in the conference room of a medical center as a break. It's just brilliant. You know, it costs nothing. There's no harmful side effects. You know that, and so I think things are developing out there, and we should look to support them. We should look to, you know, poetry and short stories, or you know, whatever is you know, even wise sayings. You know, the things that can bolster people's spirits and also distract them. And nourish them. Thank you so much. I think, anyone else have something to give on that besides me? There's probably. Okay. I do want to articulate maybe one concern that I have, which is about the elderly in particular. You know, I'm fully understanding and supportive of you know, the work that needs to go into COVID-19 and the anti-racist movement, and I am very involved in these things. But I feel like the suffering of the elderly and the situation in nursing homes and other facilities they're kind of being written off and their family members too, I think. So I know that, for example, just to mention suicide again, that there are particular risk for suicide. Those that are at all have access to the means, in general, they're at great risk, as are teens and young adults. So I feel like the kind of check-ins that Nancy talked about, the 10 congregants calling, you know, all the ways in our shul, we have something in our synagogue, we have the mensch squad, which means people you can contact to pick up your dry cleaning or to whatever it is, grocery shopping, so I think that checking in on the elderly and really being mindful of their despair and isolation, and kind of difficulty asking for help, both practically and emotionally, maybe something to really focus on in our communities. I'm giving all the sermons today, and it doesn't. Okay. You know, I do want to mention something, last thing then. I had come up with 7 interventions that synagogues might consider for preventing suicide. And one of them is to link up with other houses of worship of other faiths in the vicinity. And the reason I mention that is some of the people who are distraught and perhaps have a mental health challenge or a substance abuse issue, problem, they will see where the doors are open and where they might find something. And I know that in our synagogue, people have come who are not of the Jewish faith, not part of the Jewish community, but who have been looking for something help. And so I think that if, to the extent possible, if we could link together to kind of be a safety net for people who are really in danger and isolated, and just imagine if you know, 3 clergy from you know, different houses of worship were to consult with each other and say, did so-and-so come to see you? Because I think, you know, she came to me, and together I think we can be a supportive team and get her the help she needs, or follow up, you know, and make sure that it's working. I just was thinking about those connections, and since this is a Jewish conversation with our many interfaith contributors and hosts, I just really wanted to say the value of those connections. So, so our time is slipping away. I want to hand it over to the wrap up.
Thanks, Simcha.